Good morning, Marsha, Mabel, Jazzy, Roblox Cherry, Cindy. Good morning. Truly Africana. Good morning. Danielle, I see you. You're welcome, Martha. I'm excited you're here too, Ashley. Wow, all the way from Nigeria. Good morning. Good day. Thank you, Danielle. I love all of you guys as well. Congratulations, Frances. Guys, don't mind the background in my office. I literally clean it up every week, and every week it goes back to crazy. It's just nature of the game. From Nepal, hello. Dejanay, yes, you will. Good morning. Good morning. Crystal, thank you for joining. All right, guys, we'll start in about 15 minutes. We start at 11 a.m., so we have some time. Fantastic. We can't. We start at 11 a.m. Congratulations, Samuel. Thank you, Jax. So I don't want to start early, guys, because I did say 11 a.m. Eastern Standard Time, and I don't want anybody jumping in at 11 a.m. and they miss some really good information. So I do have to wait until 11 a.m. to get started. But at least this is my first time doing YouTube Live, so at least with this, it doesn't cut you off. There's not a cap to how many people can enter. Munzero, the coolest. Thank you. You're right, Terry. To be early is on time. To be on time, you're late. And if you're late, you should have never showed up. You're right. Can you talk about NCLEX? Well, that's the thing. Anything that I talk about, this is information that I don't want everyone else to miss. So I have to wait until 11 a.m. because I don't want to have to repeat myself either. Tomorrow's my birthday. And so my husband scheduled some stuff for me today, which I didn't know. I just found out about this morning. So I'm going to be here for about 2 hours and I got to get off. He has some things scheduled for me and the kids. But this is going to be a multi-part series. So I'm going to make sure I cover everything. Not on this live, but on the next one. I'm going to add the new generation NCLEX questions. I'm going to add some onto there. Now, those questions are long because they're case studies. It takes like 5 minutes to just read the whole thing. So but I'm gonna make sure that I add them on the next live that I do, so you guys can just start getting acquainted and adjusted. Thank you, thank you. Yeah, I think I stopped celebrating my birthday after I turned like 25 or 27. So yeah, I'm turning 25 again. Thank you guys. Matthew, I'm doing a live in the office, okay?
Right now?
Well, it starts at 11 a.m., but I still have students on there, so.
I'm like, you know the thing that's.
Don't come in your underwear because my laptop's facing the door. Do you want me to come to you?
Yes, please come.
Okay, honey, I'm coming. Thank you, thank you. Yes, mom life. All right, guys. I'll be back in a few. Thank you for the birthday wishes. 10 more minutes. So, yeah, next week. No, excuse me, not next week. On the next live, I'll incorporate the next generation NCLEX questions. And you guys don't have to freak out the way that you guys are freaking out. The next generation NCLEX questions, 15. You're going to get 15. Now, mind you, they're a whole book. Each question is a whole book before you actually get to the actual question of what they're looking for, but it's only 15. And the rest of the questions are the normal NCLEX questions that you guys have been getting. There's no need to freak out. How's Florida? Nice and warm, Danielle. So everyone have the book? Good, good, good. Congratulations, Esau. Someone on my TikTok page said that website that had the free book, they took it down. I don't know if that's true or not. Don't read too fast, please. Okay, I'll try not to. I'll try not to read too fast. If I am reading too fast, just let me know in the comment section. I'll try to slow down. Where can I get the book? Well, I was told, and when I went and checked, I did see it there. If you go to zlibrary.com or zlibrary.org, I think it's .com, zlibrary, they have a whole bunch of PDF books for free, and that is one of those books. And I know lots of students were able to get it, but I think a couple days ago, someone in comment section said that they put it down. But I don't know if that's true or not. I didn't check for myself. The book that I'm going to be using today on this live. That's the book I'm talking about. Z Library, Z as in zebra, library, but it's one word. ZLIBRARY, zlibrary.com or .org, but I think it's .com. Millie, send the book again, please. I never sent the book. I just showed you guys. So this is what the book looks like: Priority Delegation, Management of Care of the NCLEX RN exam. This is the book that I've been telling you guys to get that I'm going to be using for the live. You can go to public library. Thank you, Chantal. Will you have any neuro live sessions coming up? I start neuro this week. Neuro Live will be coming up soon. I don't have a date for that. However, I have lots of videos in my neuro playlist. So just check them out. Go to my playlist. I have neuro, GI, GU, cardio, respiratory, all of them. So go to the one that is specifically for neuro. You'll see lots of videos there. Okay, so Reina, you asked, is this the same as new generation NCLEX? So what I was saying before, this is not, this is the normal NCLEX that we've had, but you have to keep in mind, and if you haven't watched a video I did already on the new generation NCLEX, please go back and watch it. The new generation NCLEX, those type of questions, you're going to get 15. And all of the rest of the questions that you're going to get are going to be the normal NCLEX questions that students have been getting. So what I'm going to do on my next live, I'm going to make sure I incorporate that new next generation NCLEX questions so you can see what they look like, what you know the test writers are expecting from you. But please understand, your whole exam are not going to be those types of questions. They're only going to be how many? 15. Everybody, no matter you pass, fail, you're going to get 15 of those questions. And then the rest of the questions are going to be the NCLEX type questions that you know, I wouldn't say in love because you guys don't love them, but that you guys know. I miss the music that used to come on your videos. Can you add it back? Here's the thing. So the music I had on those videos, I had a different editor, and I'm not going to get into details, but I had to switch editors. And so that editor that I had, that was the one that made the music. So if you guys like the music, maybe I'll find something else to have at the beginning. But personally, I thought you guys would appreciate it more that I just get into the video and you don't have to wait for the music to finish before I can get into the questions. So let me know. Few more minutes. It's almost 11 a.m. This is it. This is what the front cover looks like. Thank you, Sammy. Sammy said he just went to the website and the book is there. He just downloaded the book. So go check it out. The book is there. Thank you, Sammy. Yes, Chantal, thank you. I am super busy. I wanted to kick myself when I even decided to do this, but um I I never stop being surprised or amazed how many students are struggling. A lot of students, and this is all over, not even all over the United States, all over the world. They're paying all this money to be in a nursing program, and I'm getting the same feedback that their nursing instructors are just reading from the PowerPoint. They're not explaining anything. They have to go to YouTube to really try to learn what they're supposed to be learning in school. That's awesome, Denise. All right, few more minutes and we'll get started. Of course, LPN can join this live. Absolutely. I'm actually going to be talking a lot about the differences between the LPN and the RN, so the LPN also can understand priority and delegation and what's within their scope of practice, and when they would have to stop and reach out to the RN. Absolutely. Anyone know the website? The website is Z Library, but I'm not sure if it's .com or .org. Somebody, can you type it in the comment section so the other students can see, please? The website for the book. Hmm. Oh, book name one last time. All right. The book name, here it is. Prioritization, Delegation, and Management of Care for the NCLEX RN exam. And they have a couple versions of this. So the one that I'm going to be teaching out today is the one that has the purple thing on top. Thank you. Mitz B went ahead and put the link in the comment section so you guys can look at the comment section. Professor D, on your website, do you have fluid and electrolytes that I can purchase? To be honest, I have so many on that website. I don't know. You got to go take a look. I don't recall if I have fluid and electrolytes on there. You got to check. I just don't recall. Who's the author? Hargrove, Hutto, Catherine Callgrove. Right on top, right here. All right, guys. 11 a.m. Let's get started. Now, again, guys, Tomorrow's my birthday, so my husband has a whole day planned for me, so I can't be on here long with you as I plan. But I'm gonna give you a little time. The first thing I want to cover with you, I typed this up, I don't even know how long ago, years ago, and I'm gonna post it on my website. Well, I'm not gonna do it myself, but I'm gonna have my website guy posted on my website so you can have a copy. But for now, I'm just gonna read this to you guys. This live is going to be recorded. I'm gonna post it, so don't freak out. Anything that you feel you didn't catch, you can watch it again. The first thing I want to talk to you guys about are the types of patients that the registered nurse must keep, that they cannot delegate to the practical nurse. They cannot delegate to an unlicensed assistive personnel such as a PCT or a UAP. The registered nurse must keep that patient. I'm going to go over that now. So let's talk about this. Who must the registered nurse keep that they cannot delegate to anyone else? Any patient that requires an in-depth assessment. Who would require an in-depth assessment? An admission, right? And when I say admission, it doesn't matter if the patient has been in your facility. If they're new to your floor, right? That's an admission. Okay. So that type of patient will require an in-depth assessment. You're going to have to do a head to toe assessment. Remember, assessment is not only physically looking at that patient, it's anything you do to get information. So going through that patient's chart and getting their history and finding out about their allergies and finding about family and that's also an assessment. Anything that requires an in-depth assessment, the registered nurse has to keep. So a patient that's being admitted, the registered nurse has to keep. Anything that requires in-depth teaching, that very first time teaching, the registered nurse has to do that. So what is an example of a type of patient that requires in-depth teaching? Patient being discharged. As students, you always think, okay, well, this patient is being discharged. They're fine. We can delegate that to the LPN. No, you can't. Because along with discharge comes what? A lot of teaching. And that is the responsibility of the registered nurse. What other types of patients must a registered nurse keep? The first time feeding or first time ambulating, and a patient with deficits. So if a patient had a stroke, and now they've got left side weakness, and that's their first time walking, the registered nurse has to keep that patient. Why? Because it's the registered nurse's responsibility to call up the healthcare provider and say, hey, can I get an order for a physical therapy evaluation? Because this patient looks like they might need a walker. Can I get an order for uh, a, a speech evaluation? Because the first time the patient ate, which the registered nurse is going to be the one feeding that patient for the first time because they may have dysphagia after the stroke, they kind of look like maybe they were struggling, and I want to look at that swallow eval. It's the registered nurse that has to call the healthcare provider and ask for those assessments, ask for those evaluations, ask for DMEs. So those type of patients, the registered nurse has to keep. Who else is the registered nurse going to keep? Blood transfusions. I know in the real world, guys, you guys see the LPNs doing blood transfusions, but remember, in the testing world, it's a perfect world. And for those purposes, it is the registered nurse who has to handle blood and do those blood transfusions. Okay. What else do I have? Piggybacks, registered nurse. IV pushes, registered nurse. Care plans, registered nurse. Now, the LPN, the LVN, the PCT, the UAP, everybody else follows the care plan, but it's the registered nurse that's responsible for creating that care plan and for updating that care plan. That cannot be delegated to anyone else. Can you open the captions? I'm sorry, I don't know how to open captions. Give me a second, guys. Let me play with this, see if there's a captions thing that I can. Give me 1 second, guys. Captions. Restrictions, none, education. Oh, I don't see where to allow captions. If anybody, hold on a second, guys. If anyone knows how for me to add captions, could you let me know in the comment section? I'll put on the captions. I just don't know how. Okay. Thank you, Vanessa. I just blocked them. I don't know how they're still posting. These bots. Captions have to be opened by the person own settings. Okay, guys, I'm sorry. I'll look at I'll figure out how to do the captions for the next live stream. I just don't want to stop now trying to figure it out now. Okay, guys, I'm sorry about that. Anyway, as I was saying, so the RN keeps the blood transfusions, the RN keeps the piggybacks, the RN keeps the IV pushes, PCAs, the patient controlled and analgesics, that machine. The RN keeps that patient that's on a PCA. What else? Any medication, guys, that is caustic, that if there's infiltration, it can actually cause death to the surrounding tissues, the RN has to keep. So any chemo medications, the RN has to keep, because if that medication infiltrates, it's going to cause necrosis and it's going to cause death to the surrounding tissues. So that cannot be delegated to an LPN or LVN. Central lines, the registered nurse must keep. The most unstable patient, the registered nurse must keep. And so we're going to get into that for you guys to figure out who's the most unstable patient. But you have to say to yourself, when you're looking at a list of choices, for when a question asks you, which patient are you going to see first, what they're really asking you is who is the most unstable patient. And you have to say to yourself, between these choices that I'm looking at, who is most likely to die the quickest? And that's your most unstable patient. One second, guys. You can block him yourself, point to his name, and to the right side, there are 3 dots. I've done that a million times. Biba, thank you so much. But I've done that. I've clicked report and I've clicked remove. There's no choice for block, but you can report and remove. And I've done that twice for each. And this thing is still coming up. But individually, guys, you can block that Barty person. Just block them. Okay. Next, so we talked about what type of patients the registered nurse must keep. Let's talk about the LPN. We do not give the LPN or LVN enough credit, because there are lots of patients and lots of things that LPN LVN can do. They can do sterile dressings, wound care, they can give routine meds, they can do IVs, absolutely. Now, they can't give any IVs that are central lines, they can't give any IVs that are caustic, but of course they can do IVs. They can't do piggybacks, they can't do pushes, but they can do IVs, absolutely. They can do suctions. They can do trachs. They can do G tubes. They can do NG tubes. They can do catheters. There's lots of things that the LPN LVN can do. So that's important to know. Floating RN. So let's say you have a question about a registered nurse. They've been a registered nurse for years, but they're floating to your floor. They are new to your floor. We don't care that they've been a registered nurse for years. We're going to treat them or delegate as if they were an LPN or LVN, which means we're going to give them the most stable patient, because the LPN or LVN always gets the most stable patient. So don't be tricked by a test question telling you that a nurse has been a nurse for 50 years. If they're new to your floor, we don't care that they've been a nurse for 50 years, because they're not used to caring for your type of patients. So you're always going to give them the most stable patient. The only exception to this rule is going to be an RN that's been an RN for years, but they're floating to your floor. However, you have a patient that matches the background of that RN. Then you don't have to give them the most stable patient. If you have a patient, for example, you have a patient that's on the med surg floor and they have a gunshot wound, and you have an RN floating to your floor, but they're floating from the ER, right? They've seen lots of gunshot wounds. You can give that RN the gunshot wound even though they're not the most stable patient. So that's the only exception to the rule. If an RN is floating to your floor, you're going to give them the most stable patient unless you have a patient who, whatever they have going on, their diagnosis matches the background of that floating registered nurse. Nurse graduates, you have a new nurse. They're RN, but they're a brand new RN. You're going to give them the most stable patient. Okay. I want to talk to you guys about that one. Let's see. Maybe delegated to the PN. So let's talk about everything we can delegate to the LPN or LVN. Maintenance teaching. What do I mean by maintenance teaching? Well, remember, I told you the registered nurse is responsible for that very first teaching. Patient comes in, all of that in-depth assessment, all of that in-depth teaching, the registered nurse does. Now, the LPN or LVN comes behind that registered nurse and they do maintenance teaching. So the registered nurse has already taught the patient about this new hypertensive medication that they're on, right? They did that. Patient's been there a couple of days. Now the LPN has picked up that shift and they're seeing that patient. They're going to remind that patient, hey, don't forget this medication can drop your blood pressure. We don't want you to have orthostatic hypotension. So if you need to get up to go to the bathroom, make sure you press that call button. Make sure you get up slowly. Make sure you dangle. All of the stuff that the LPN, LVN is teaching the patient heard already from the RN. So what the LPN, LVN is doing is called maintenance. It's maintenance teaching because the initial teaching was already done by the registered nurse. Very good, Erica. Reinforced teaching. That's what the LPN, LVN is doing. They're reinforcing that initial teaching by the registered nurse. Very good. What else? So maintenance teaching, maintenance assessment. I don't know why. You guys tend to think that the LPN or LVN, they don't do assessment. So let me get this right. We have a patient that was admitted for hypertension. They've been in for a few days. Now the LPN has picked up the shift. They're about to see that patient. They're about to give that patient an antihypertensive medication. Don't they take that patient's blood pressure before they give that medication? Yeah. Isn't taking that blood pressure, isn't that an assessment? Of course it is. Isn't that LPN going to tell the patient about all the important things that I just mentioned? Of course they are. So yes, LPNs do assessments. They just don't do the initial assessment, the first time assessment, the in-depth assessment. That belongs to the registered nurse. But they absolutely do teaching. They absolutely do assessments. What else? Routine medications. The LPNs can give routine medications. They can do sterile wound cares. They can do vents, trachs, ostomy, pegs, NG tubes, indwelling urinary catheters. They can do IV meds. But remember, when I said IV meds, they cannot be caustic medications, such as the chemo meds. And they can get the most stable patient. So now let's talk about the UAPs. What can be delegated? Hi, Marjorie. Thank you. What can be delegated to the unlicensed assistive personnel? Lots of things. The unlicensed assistive personnel, they can record and report, which means they record the vital signs and they report the vital signs. That does not require any judgment. That does not require any evaluation. All they're doing is recording and reporting. They're taking a blood pressure, they're taking a temperature, they're taking a pulse, and they're reporting it to the nurse. Now, can a UAP listen to lung sounds? No, because auscultating lung sounds, doesn't that require clinical judgment? Aren't you supposed to, when you're listening to the lung sounds, aren't you supposed to know the difference in those lung sounds being clear versus having crackles versus having rails versus having wheezing sounds? Yes. So that requires evaluation, clinical judgment, and you do not ever delegate anything that requires critical thinking to a UAP. And I'm not saying that to say that UAPs don't know how to critically think. I'm not saying that at all. What I'm saying to you is that's how you need to think about it if you want to get the answer correctly. If it requires critical thinking, you cannot delegate it to the UAP. So they can record vital signs and they can report it. They can transfer equipment from one place to another. They can transfer medications from one place to another. So you can send them upstairs to go to the pharmacy and get that medication and bring it back to you. Or you can send them to the blood bank to go get the blood and bring it back to you, because all they're doing is transporting medication or equipment. They're not doing anything that requires critical thinking. They can transport patients. What type of patients? Stable patients. If the patient's not stable and they need to be transported somewhere, guess who has to be there? The registered nurse. But if the patient's stable, yes, they can transport stable patients. They can do activities of daily living, such as bathing, dressing. They can do glucose checks. Yes. Because what is a glucose check? All they're doing is recording that number and reporting it to the nurse. That's it. Right? So let's talk about the UAP. They can remind the patient, oh, Mr. Such and Such, remember your nurse said to dangle your feet. Remember the nurse said to get up slowly. Remember the nurse said to take sips of your water. They can remind the patient. So they can remind the patient, they can record and report, they can do vital signs, they can check the blood glucose levels. They can do INO, because INO is just recording and reporting. Record the number, report it to the nurse. They can do ADLs, they can transfer equipment, they can transfer medications. Sharon, I was so unsure about blood transport. Okay, you're sure now, right? Good. All right, let's talk about rules of management. Rule number 1, and again, I'm going to have my web guide go ahead and post this on my website so you guys can see if anybody wants to see this list I made. So rule number 1, do not delegate the functions of assessment, evaluation, and nursing judgment. You can't delegate that, okay? During your nursing education, you learn that assessment, evaluation, and nursing judgment are the responsibility of who? The registered nurse. Again, assessment, evaluation, judgment, that belongs to the registered nurse. You cannot delegate that to anybody else. Number 2, this is not the real world. Every semester, guys, this happens every semester. The strongest nursing students are the students who have no medical background. So the only thing that they're pulling from is what they see in the textbook. The students that I see struggle the most are the ones who have medical backgrounds, the LPNs or LVNs that are going back to school to be RN, or the students who were an EMT, paramedic, CNAs, those students that have medical backgrounds, that they've worked in the hospitals or they've worked in the rehabs. Because what happens is they're fighting what they're seeing in the textbook versus what they see happen in the real world. Remember, when you're testing, guys, it's a perfect world and you have to go by your textbook. So rule number 2, this is not the real world when you're testing. Do not make decisions regarding management of care issues based on decisions you may have observed during your clinical experience in the hospital or the clinical setting. Remember, NCLEX is the ivory tower of nursing. The answer to the questions are found in your nursing textbook. Ask yourself, is this textbook? Don't go by what you see on the floor, or don't go by what you see happen to your family members or your friends, or even what happened to you. Go by your textbook, because let me tell you something. In the testing world, we're not concerned about money. In the real world, we're concerned about money, so we're going to cut corners. In the testing world, we're not concerned about staff. We're not concerned about equipment. We're not concerned about resources. We're not concerned about time, except for there's certain situations when it's emergency, time is of the essence. But for the most part, we're not concerned about time. We have enough of these things to do whatever we have to do for our patient. So whenever you're trying to figure out what your answer is going to be, don't ever use one of those 5 things that I just mentioned to be a consideration when you're trying to factor in what your correct answer should be, because we're not concerned about those in the testing world. Okay. Rule number 3, delegate activities for stable patients with predictable outcomes. I'm going to get to that in a second. If the patient is unstable or the outcome of an activity is not assured, do not delegate it. So you can only delegate that patient, number 1, that's stable, and number 2, has a predictable outcome. Based on what you have learned in the textbook, we expect this to happen. So that's another perfect example that I gave you for that the hypertensive patient. We expect that if we give them an antihypertensive medication, it may drop that patient's blood pressure. Antihypertensive medications, those are routine medications, right? We can delegate that to an LPN. But if that patient's having an episode right now where they're in hypotensive crisis, hence the word crisis, we don't know which way that patient's going to go. That's why it's a hypertensive crisis, hypotensive crisis. Can we delegate that to an LPN? Absolutely not, because we don't know what the outcome can be. That patient's not stable, so we cannot delegate that to an LPN. We would have to keep that type of patient. All right. Number 4, delegate activities that involve standard, unchanged procedures. Activities that frequently reoccur in daily patient care can be delegated, such as, again, routine medications, routine dressing changes. Bathing, feeding, dressing, and transferring patients are examples, and those are examples of what you'd give to an unlicensed assistive personnel to do. Activities that are complex or complicated should not be delegated, because if something's complex or it's complicated, what's that going to require? In-depth assessment, in-depth evaluation, and in-depth teaching. All of those responsibilities of who? The registered nurse. Number 5, remember priorities. Remember Maslow's ABCs and stable versus unstable when you're determining which patient the RN should attend to first. And I'm going to get into that once we get into this book. We're almost there, guys. I'm almost done with my rules, but these are important rules that you need to know, because you're not always going to know. One second, guys. You're not always going to know the answer to the question. But if you can understand this prioritization delegation, you can still get the correct answer. Okay. Keep in mind that you can see only one patient or perform one activity when answering questions that require you to establish priorities. So when you have a list of patients and you're being asked, which patient are you going to see first? You can only see one. Say to yourself, who is most at risk for dying or being severely injured? That is who you're going to see first. All right, let's talk about priority patients. Who are going to be your priority patients? Priority patients, anyone where airway is obstructed, or it's, what's the word I'm looking for? Decreased, right? Because who cares about anything else if our patient's dead because they couldn't breathe, right? So issues with airway, it's going to be a priority. Now, let me talk about this before I move on, because here's how you guys get tricked. You see airway and you want to jump on it. but it has to make sense. So if you have a situation, I'll give you an example. You have a patient that just had a burn, and um, in the question, they give you vitals, and they tell you that you assess the patient. There was no, singed nasal hairs. There was no soot, around the upper lips. There are no signs and symptoms of smoke inhalation. The lungs were clear. They're telling you this in the question. So they've gotten rid of airway as a problem. And then they're asking you what is going to be a priority nursing intervention. And we're talking about burns here. And so they put in there, dehydration, skin integrity, something else, and airway. And you guys jump on airway just because airway's there. Why would you choose airway when in the question, in the body, they told you nothing was wrong with the airway? Matter of fact, you already assessed the patient's airway and they were fine. You see, that's how the test writers trick you. You cannot be trying to think like a robot. You have to think critically. If they already ruled it out, nothing's wrong with the airway, don't choose airway because it's there as a choice. That's number one. And number two, another way that they'll try to trick you is they'll put airway as an answer choice, but whatever that patient has going on has nothing to do with the airway. What's a good example for me to give you? Okay, so example is a patient that just got their pinky toe amputated, and you come into the room and they're crying. No, I have a better one. Patient just had a left mastectomy, and you come into the room and they refuse to look at the dressing. You're trying to do teaching, they're not making eye contact. They keep looking down, or every time you're trying to talk to them, they keep looking away. What's going to be your priority? And instead of addressing the issue that this patient just had a mastectomy, and they're not ready for teaching because they're not even making eye contact, they're not even acknowledging that you're changing that dressing, they give you an option of assess the airway. What does assessing the airway have to do with that left-sided mastectomy? They didn't give us any signs and symptoms of that patient being in respiratory distress at all, right? You cannot choose airway just because it's there, and these test writers will try to trick you because they know you've been so conditioned to choose airway when you see it. So anyway, airway compromise. If the patient's airway compromise, that's going to be a priority patient. Who else? Hemorrhage. Hemorrhage. Let me tell you something. If a patient has had surgery, I don't care what type of surgery it is, whether it was a left toe amputation, it was a mastectomy, appendectomy, I don't care. If a patient had surgery, we're always going to be concerned about infection, DVT, PE, or hemorrhage, them bleeding out. Patient bleeding out, guys, can kill them. That's going to be a priority, right? So if we have a test question and they tell us that that patient just had surgery, and they tell us that that blood pressure is low, and they tell us that that heart rate's increased, what are we suspecting? Hemorrhage. That's a priority patient. Let's keep going. Chest pain. Yes, that's going to be a priority because we're concerned about what? That patient having a heart attack, that patient having myocardial infarction, right? Because an MI that can kill you, right? Yeah, anything that can kill your patient, that's going to be a priority. What else? Decreased level of consciousness. Professor D, why decreased level of consciousness? I'll tell you why. If a patient has been awake, alert, oriented time 3 days, been fine, and then all of a sudden they have a decreased level of consciousness, that's a priority for you because something very severe is happening, that their cognition has changed suddenly. And usually it's due to lack of oxygen to the brain. Now, there can be some other reasons, but guess what? All of those are really bad and can kill the patient. So a patient who's been fine, then all of a sudden has a change in their level of consciousness for the worse, that's a priority patient. They could have had a stroke, right? So many things could have happened. Next, seizure. Seizure is priority. Who else? Signs and symptoms of an MI, such as chest pain. Here's another one. When you see these words, your ears better perk up. Light bulbs better be going on top of your head because most likely this is going to be a priority. When you see that word, suddenly. So the patient was this way, and suddenly they're that way. Now, if whatever comes after the suddenly is a good thing, so they were down, now suddenly they're up, there is a good thing, we're not concerned about it. But for most of the time, for testing purposes, the patient will be good or they'll be okay, then suddenly, and everything goes down here hill. When you see that suddenly, uh-oh, that's a priority patient. What else? Sharp. So, and I'm putting another word next to sharp, severe. There's a difference between the patient saying they have pain and they have a sharp pain or severe pain. What does that sharp or severe tell you? Something suddenly happened. It's acute. We got to figure out what's going on with this patient. That sharp pain tells us that something probably just ruptured. Something severe has just happened that needs to be addressed. Of course, all of a sudden, and any change that shows a decrease in the patient's status. So they'll show that the patient was this way, and now the patient's going downhill. That's going to be a priority. We need to get to that patient, find out what's going on to correct that issue. All right. Very good, Chantel. I did not have that on my list, but I'm so Chantel, you be watching my videos. Chantel added, and I'll talk to you about this. Hypoglycemia. What kills a patient faster? Hyperglycemia or hypoglycemia? Hypoglycemia. The body has so many mechanisms to save you when your blood sugar's high, right? You get thirsty, you want to dilute the urine, you start urinating all over the place, you start drinking lots of water. Your body has these mechanisms to save you, but hypoglycemia, that's it, you're on the ground. Yes. So hypoglycemia absolutely will kill you much faster than hyperglycemia. All right, test taking strategies. This, I'm going to tell you to only use these if you don't know what the answer is. If you know what the answer is, don't use these strategies I'm about to give you. Just choose the correct answer. But if you have no idea what the answer is, I'm telling you, you're looking at the question, you're looking at the answer, and you have no clue. Here are some strategies to use. Look for opposites. You have no idea what the answer is, but you see two opposites, take a chance, choose one of those opposites. Look for almost exacts. So you have no idea what the answer is, but you see two choices that are very similar. Choose one of those. Look for umbrella answers. You have no idea what the answer is, but you notice one of your answer choices incorporates one, two, or even three of your other answer choices. That's called an umbrella because it's covering the other answer choices. Choose that. Stay away from all inclusives. Words such as always, only, never, those are all inclusive words. Those usually are not your answer choice because guess what, guys? There is always an exception to a rule. There's always an exception. So we stay away from those answer choices that include always, never, only. Be careful of the answers that have sometimes, maybe, possibly. And the reason for that, guys, is because it's not very clear. It's very ambiguous. So I'm not saying that's not the correct answer, but if you have no idea what the answer choice is, be careful before you choose that as one of your answer choice. Before calling the doctor, choosing the answer of call the doctor, say to yourself, the other choices on this list, can I do any of these to help my patient before I turn to call the doctor? And I say this, guys, because we all know the doctor has their license. They sat down for their boards. They know what they're doing. You're sitting for your boards. They want to see if you know what you're doing. So I'm not saying that's never going to be the answer of call the doctor because there are certain situations where there's nothing you can do. It's out of your hands. You have to call the healthcare provider for orders, right? But most of the time, there's something you can do to help your patient before you have to call the healthcare provider. So look at your other choices and ask yourself, are any of these going to help my patient before I call the healthcare provider? If not, go ahead, call the healthcare provider. But if they will, do that first. Select all that applies. Choose the trick. I can't speak. Treat them as true or false. As students, you guys tend to want to do the select all that applies. You guys want to group them together for it to make sense. And that's how you get it wrong. You have to read the question and each individual choice, so one by one. If it's true, you keep it. And if it's false, you get rid of it. One by one. Don't try to group them together. Okay, so select all that applies. Treat them as true or false. When being questioned about a medication, oh, this is important. Give me a second. When being questioned about a medication, most likely you're being asked about one of three things. This is important, guys. When you're being asked about a medication, what they're really asking you about is either one, the adverse reaction of the medication, two, the nursing intervention that you would do for that medication, or three, the signs and symptoms of that medication working too well. I'm going to add a fourth one, but very rarely do you get this fourth one, but I'm going to add it, the indication why we're giving this medication. That's too easy. You hardly ever get that, but once in a while, you'll get that. So there's actually four. Here's what you guys tend to do as students, and this is the mistake that you guys make. You'll get a diagnosis, you'll get a medication, and then they'll ask you your nursing intervention or what you're going to do for that patient. And what you guys tend to do, you're focusing on that diagnosis and you're answering the question from the diagnosis instead of answering the question from the medication. So example, you have a patient that is a new diabetic. They're on insulin and you just gave insulin, or you're about to give insulin. No, you just gave insulin. What's going to be a priority? As students, you tend to be focused on the diagnosis of diabetes, but the question is not asking you about diabetes. They're asking you about what? Insulin. And again, what kills people faster? Hypoglycemia or hyperglycemia? Hypo. So when it comes to insulin, we're going to be concerned about that medication working a little bit too well and causing a hypoglycemic reaction. Do you see what I'm saying? So be careful when you have a test question and there's a medication involved. Make sure you understand what the question is asking you. Are they asking you about the diagnosis, which most of the time they are not? Or are they asking you about that medication? What is your nursing intervention for that medication? What are you going to watch out for after you give that medication? What are you going to assess for before you give that medication? What are you going to teach the patient about that medication? You see what I'm saying? All right. So that's my list. I'm going to make sure I post this up on my website for you guys. Now, but jump to page. Where do I want you guys to jump to? Jump to page 2, all of that, and it's just page 2. Jump to page 2. Where they're talking about the example, that's what I'm going to go over with you right now. Page 2. So on page 2, it says, the nurses came for a client diagnosed with congestive heart failure who's currently complaining of dyspnea. Which intervention should the nurse implement first? 1, administer Lasix, a loop diuretic, IV push. 2, check the client for adventitious lung sounds. 3, ask the respiratory therapist to administer treatment. Or 4, notify the healthcare provider. This is a great example, guys. So look at those 4 choices they gave you. They told you the patient has CHF and you're about to give them a diuretic. What are you going to do? The correct answer is to check the client for adventitious lung sounds. The patient has congestive heart failure. They're holding on to all this fluid. We're giving them a diuretic to get rid of that fluid. Okay. ADPI, assessment, diagnosis, planning, intervention, evaluation. The first part of ADPI is what? Assessment. We're going to assess that patient. Listen to those lung sounds. Look to see the degree of the CHF that patient has. We're about to give that patient a diuretic. By the way, because I don't think I mentioned this already, but I'd say about 98% of your test questions are going to be based on these three things. ADPI, which is assessment, diagnosis, planning, assessment, diagnosis, planning, intervention, and evaluation. That's your ADPI. The second thing your questions may be based on is ABCs, airway, breathing, circulation. And the third thing that your test question may be based on is Maslow's hierarchy of needs, which with Maslow's hierarchy of needs, physiological integrity always comes first. That's always number one. And you'll see that shortly. We're going to talk about that shortly. So with this test question, look at our choices, guys. So remember the situation. Patient's got CHF. We're about to give them a diuretic. What are you going to do? One said, give Lasix the IV push. 2, check the client for adventitious lung sounds. By the way, adventitious is bad. It's not good. I know when you hear that word adventitious, you think it's something good, but it's not. When you hear adventitious lung sounds, that is bad, okay? 3, ask the respiratory therapist to administer treatment, or 4, notify the healthcare provider. So let's talk about this, guys. 3, asking the respiratory therapist to administer treatment. First of all, do we give orders to other departments? That's number 1. Number 2, do we ever pass the buck? We never pass the buck. Anything that you can do for your patient, you do for your patient. Okay. 4, notify the healthcare provider and tell them what? I love when you guys choose that as an answer. Notify the healthcare provider and tell them what? Because you have to do an assessment to know what's wrong with your patient so that when you call the healthcare provider, you have information to give them, right? So what are you going to tell the healthcare provider when you call them anyway? All right, moving on. Go to page 3, the very next page. Go to page 3. And there's an example at the very top. I'm going to go over this example. The client diagnosed with peptic ulcer disease has a blood pressure of 88/42, apical pulse of 132, respirations 28. The nurse writes a nursing diagnosis of altered tissue perfusion related to decreased circulatory volume. Which intervention should the nurse implement first? 1, notify the lab to draw, type, and cross match. 2, assess the client's abdomen for tenderness. 3, insert 18-gauge catheter infused lactate ringers. Or 4, check the client's pulse oximeter reading. And the correct answer is 3. Remember, I told you most of your questions are either going to be ADPI, ABCs, or Maslow's hierarchy of needs, right? When it comes to ADPI, if in the body of the question, they tell you that you already assessed and you have the information that you need to perform a nursing intervention, why, when you get to the answer, you're going to choose an assessment? Because it's there? Does that make sense? Look at this. Look at all the clues they gave us that tells us we already did an assessment. We should already know what's going on with the patient. Number 1, they have peptic ulcer disease. We already know patients with peptic ulcers, what are we concerned about? That ulcer now bleeding, right? Peptic ulcer disease, you're always going to be concerned about it bleeding. So they told this patient has peptic ulcer disease. Look at that blood pressure, low blood pressure. Did I not just tell you when that patient has a low blood pressure and a fast heart rate, we're concerned about bleeding? Yeah, look at that blood pressure, 88/42, and look at the apical pulse, 132. That is a perfect picture of a patient that's bleeding. You bleeding somewhere with that blood pressure being low and the heart rate being up. So the fact that they have a peptic ulcer disease, which we know that puts them at risk for bleeding, and now they're telling us that the blood pressure is low and the heart rate's up, we're saying, whoa, yeah, this patient is bleeding out somewhere. Let's keep going. Respirations 28. Why do you think those respirations are 28? They're bleeding out. Oxygen, which is being carried in the blood, is not perfusing those tissues. So the patient's respirations increase because they're trying to get more oxygen. So all of this paints a picture for us that this patient's bleeding out somewhere. We have enough information to do something about it. Why are we still assessing? You see D, choice 4, where it says check the client's pulse ox. What is that pulse ox going to tell us that we don't already know? This is how they try to trick you guys. They give you a question that shows you you're assessing, but don't choose an assessment unless that assessment is actually going to do something for you. What is that assessment? Us looking at that pulse ox, what is it going to tell us that we don't already know? Us taking that pulse ox, how is that going to change the nursing intervention that we would have done for that patient? Absolutely nothing. We have enough information that tells us this patient's bleeding out. We have to do something. What are we going to do? Give them fluids. By the way, guys, when the patient's going through the hemodynamic status is decreased, they're losing blood within that vascular space. The best type of fluids that we're going to give them is going to be either lactate ringers or normal saline. So 3 is the correct answer, and say insert the 18 gauge catheter and infuse lactate ringers. And I know what some of you guys are thinking. Oh, Professor D, it didn't say with the doctor's order. It's a choice. If it's there as a choice, that means it's what's the word I'm looking for? If it's there as a choice, that means it's an option for you. Bailey, just scroll up in the comments and you'll see where you can get this book. Scroll up in the comments. You'll see it. Look at the other choices, guys. 1, notify the lab to draw and type and cross match. Is that within your scope of practice to order that? Number 1, no, it's not. The healthcare provider will do that. That's number 1. And number 2, so you're going to be calling up the lab doing all of this while your patient is dying because they're losing fluids? Does that make any sense? Absolutely not. Remember, one of the things I told you, look at your list and say, what can I do to save my patient right now before I turn my back on them to call anybody? What was choice 2? Assess the client's abdomen for tenderness. How is that going to change our nursing intervention for our patient that's bleeding out? Us looking at that abdomen to see if it's tender or not. What is it going to tell us that it doesn't tell us already? So if we check the abdomen and it's tender, is that going to tell us the patient's not bleeding out? No. If we check the abdomen and it's rigid, guess what? That just confirms what we already knew. That patient's bleeding out. Doesn't matter. We already know what's wrong with the patient. It's time to act. We have to do something to save them. So that's wrong. And I already explained why number 4 is wrong. All right, let's move on. Let's go down here to where it says Maslow's hierarchy of needs. You see this? Maslow's hierarchy of needs. Daniel Verna, this question probably would have got me. Not anymore. Not anymore. Guys, let me tell you something. By the time I'm done going through this whole series, you're going to be bad. They are not going to be able to trick you because you already see it coming. You already know how to think. Don't worry, we got this. We're in this together. All right. So let's look at Maslow's hierarchy of needs. What is most important? What is most important, guys, is always going to be physiological integrity. What's at the very bottom? This right here. Okay. Physiological integrity. What is physically keeping your patient alive and what can kill them the fastest? That is always going to be your priority. Thank you. Thank you so much, guys. All right. So let's talk about physiological integrity. What is our priority? What falls under physiological integrity when it comes to Maslow's hierarchy of needs? Airway, breathing, circulation, hemodynamic status, like that question we just did about the patient bleeding out, right? Vital signs, heart rate being out of the norm, respirations being out of the norm, temperature being out of the norm, blood pressure being out of the norm, fluid electrolytes, too much calcium, too much potassium, not enough sodium, right? Glucose, hypoglycemia, or hyperglycemia to the point that the patient's in diabetic ketoacidosis. Nutrition. If the patient doesn't eat, what can happen to them? They can die, right? So anything that physically keeps that patient alive or can kill them the fastest, that is physiological integrity. That falls under physiological needs. Now, one thing I want to address with you. Pain. Pain never killed anyone except in certain situations. There are certain situations, pain, even though pain falls under somewhere up there on the ladder, not physiological needs, there are some situations about pain, you're going to treat it the same as you would nutrition, sleep, fluid electrolytes, glucose, vital signs, hemodynamic status. You're going to treat pain. I'm going to tell you what type of pain that is. Burn. The pain from burn can be so severe, it can affect that patient's physiological status. So burn pain, you're going to treat as a priority. Um, Chest pain, because that chest pain can be a symptom of what? A heart attack, myocardial infarction. That's going to be a priority. Stones, gallbladder stone, kidney stones. That type of pain is so intense that it can affect the patient's physiological integrity, right? And the fourth one, you don't see as often on test questions, but you may get it. So depending on what the other choices are, this may be a priority, but it only depends on what the other choices are. And that comes to the cancer, the pain the patient may have. Okay. Thank you. Thank you, D. Thompson. Almost missed that. My fifth one, sickle cell. Sickle cell pain, that is a priority. And let me tell you how the test writers try to trick you. Because remember, guys, the patients who are sickle cellers, they tend to be frequent flyers, right? They come in very often due to pain. And so if you'll see this in real life where the staff really don't address it like they should, they think, oh, these people are just drug seekers, but this is true pain that the patient has. And that pain, sickle cell pain that patient feels, absolutely is enough to affect the physiological status. Okay. So when it comes to those five, remember the pain belongs just with the other ones, physiological needs. Okay. Next page, what page is this? Go to page 4. Go to page 4, and we're going to prioritizing questions, setting priorities. Okay, page 4. This is where we are. What about hospice? Okay, listen, when I say priority, I'm not saying that the other pains are not important. They are. What I'm saying to you is that when you get a question about which patient you're going to go to first, which one's going to be a priority, usually we don't prioritize pain because we say to ourselves, well, pain doesn't kill anyone. But in those situations I just mentioned, they can kill the patient. So in those situations, pain is priority. Not saying the hospice pain is not important. It is, but there may be other situations with that hospice patient where something else is a priority. So when I say these are priority, I'm not negating any of the other types of pain, if that makes sense. Daniel Verna, I never understood exactly what happens if they experience this type of pain. Do they have a heart attack from it? What happens is that pain is so severe, the patient's metabolic rate increases, their blood pressure can go so high, they can have a stroke, the heart rate can go so high, they can have dysrhythmias, right? So that's how it affects that patient's physiological status. All right, let's talk about delegating, assigning patient care. I'm on page 4. Is page 4? Yes, page 4. Look at what it says. It says, when delegating to an unlicensed assistive personnel, the nurse may not delegate any activity that requires nursing judgment. And I talked to you guys about this. These include assessing, teaching, evaluating, or administering medications to any client and the care of any unstable patient. Point blank, period. When assessing care when assigning, care to an LPN, the RN can assign the administration of some medications. And when I say, it says some medications, but let me tell you what they mean by that: routine medications. Routine medications where we know what kind of outcome we're expecting. You're never going to give the LPN a medication to give where the outcome is unknown or we don't know what to expect from the outcome, okay? So some medications, but we cannot assign assessment, teaching, or evaluating. That is your job as a registered nurse. And anything that you do delegate to the LPN or the UAP, it is your responsibility as the RN to go behind them and make sure that it was done correctly. So two things: it's your responsibility to make sure it was done correctly. Actually, three. It's your responsibility to make sure it was done correctly. It's your responsibility to make sure whatever you're delegating, they know how to do. So you have to assess their understanding. You can't delegate anything that they don't have to do, they don't know how to do. That's their responsibility. What was the third thing I was going to tell you? When you're delegating, scope of practice. You have to make sure it's within their scope of practice. So when you're delegating, you can only delegate things that is within their scope of practice. They know how to do, and you have to go behind them and make sure that was done correctly. It's still your responsibility. Yes, you delegated to them, but that task at the end of the day is still your responsibility. Absolutely correct, Vanessa 138. LPNs cannot eat. EAT. Evaluate, assess, teach. Now, we know they evaluate, assess, teach all the time, but they can't do the initial evaluation. They can't do the initial assessment. They can't do the initial teaching. They can do what's known as a reinforcement or the maintenance. Next page, page 5. Management decisions. The most experienced nurse gets the most critical patient. I've said this a million times. You guys should get it by now. Whoever is at highest risk for dying, the most acutely ill, that's what the RN is going to keep. Okay. This book has a lot of good information in it, guys. My time's very limited with you, so I'm not going to go over everything, but I encourage you to make sure you read every single line of this book. Now, let's go to page 77, respiratory. This is what we're going to start with, respiratory. Page 77 is chapter 4. Catherine said, let me go talk to my ADON about all this I'm doing as an LPN. I'm telling you, that's why so many students will get these questions wrong, because what we see in the real world is different than textbook. Thank you, Chantel. Please, guys, share this live. I'm going to post it. Share it with your classmates. Please help support my channel. The more you guys support my channel, the more videos I'm able to make for you guys, right? You guys understand how that works, right? All right. Page 77. Tilted, not broken, said appendicitis, no. Tilted, not broken. I'm not sure what you meant by appendicitis, but appendicitis is a medical emergency. Forget the pain. That is a medical emergency. That patient has to go to the OR immediately. And here's why. That patient that has appendicitis, that bad boy, let me back up. That patient with appendicitis, think about what's inflamed, that appendix. What is inside of that appendix? What is that appendix filled with? Fecal matter. If it ruptures, we now have fecal matter within what's supposed to be a sterile environment. That patient's at risk for sepsis and they will die. So forget about that pain. That patient's at risk for dying. They need to go to the they're going to be going to the OR immediately. I can't seem to find the name of the books in the comments. The name of the book: Prioritization, Delegation, and Management of Care for the NCLEX RN exam. There's very many versions, so it's the version that has the purple thing here on top. I've made videos on my TikTok, Instagram, and Facebook with this book cover. This is it. All right. So we're on page 77, respiratory management. Let's look at question number 2. Everyone there? Question number 2. The nurse is working with an LPN and an unlicensed assistive personnel to care for a group of clients. Which nursing task should not be delegated or assigned? 1, the routine oral meds for the client. 2, bed bath. 3, evaluating client's progress. Or 4, transporting a client to dialysis. Go ahead, type in the comment section. What's the answer? You guys are killing me already. Really? I've been here with you an hour and this is what you're doing to me? The correct answer is 3. The question said, which one would you not delegate? Look at our choices, guys. And they're asking, which one would you not delegate or sign? 1, routine oral meds for the clients. LPNs can give routine meds. So why wouldn't we delegate that? There's nothing wrong with that. Look at choice 2, bed baths and oral care. Unlicensed assistive personnel can do that. Why would we not delegate it? Nothing's wrong with that. Look at 4, transporting a patient to dialysis. UAPs are allowed to transport stable patients anywhere. There's nothing in number 4 that tells us something is acutely happening to the patient that they can't transport that patient. But look at choice 3, evaluating. I just talked to you guys and told you that you cannot delegate anything that you evaluate, assess, or teach. Anything that you have to evaluate, assess, or teach, you are the RN keep. So how are you going to choose one? All right, moving on. Guys, you know I yell at you, but I love you. I'm not being mean. Choice number 3. Question number 3, I should say. Which client should the charge nurse assign to the new graduate on the respiratory unit? 1, the client diagnosed with lung cancer who has rust-colored sputum and chest pain of 10 on a scale of 1 to 10. 2, the client diagnosed with atelectasis who's having shortness of breath and difficulty breathing. 3, the client diagnosed with TB who has non-productive cough and orange-colored urine. 4, the client diagnosed with pneumonia who has a pulse ox of 91 and CRT more than 3 seconds. What do you guys think? Put your answers in there. Okay. So guys, the correct answer is 3. It's 3. So let's go back. So the question is asking us, which one are we going to delegate to the new graduate, right? Remember, anyone that's floating to our floor, new to our floor, whether they're RN or not, or if it's a new graduate, we're going to treat them as an LPN or LVN, which means we're going to give them the most stable patient. So when they tell you which patient are you going to give to the new graduate, what they're really asking you is, who's the most stable out of all of these patients? Let's go to this list. Claver, don't worry. You're going to get this. It takes practice. Don't worry. Let's look to see who's most stable. We have 1, patient with lung cancer who has rust-colored sputum. Rust-colored. So I'm thinking rust-colored. Okay, there's some blood in there. All right. And chest pain. Is chest pain ever stable? No. So we're going to rule that out. We're not going to give that to a new grad. Look at choice 2. Client diagnosed with atelectasis who's having shortness of breath. Is shortness of breath stable? Absolutely not. They're having shortness of breath and difficulty breathing. How are we going to delegate that to a new RN? No, that's not the most stable patient. Choice 4, patient with pneumonia that has a pulse reading of 91%. Guys, the pulse ox, we want it. Perfect world. We want it between 98 and 100, right? But we will accept 95 to 100. Anything less than that, that patient's in respiratory distress. 91%, that patient's in acute respiratory distress. Is that patient stable? Is that the most stable patient out of the list that we've been given? But look at choice number 3. The patient that has TB They have a non-productive cough. We expect to see that in TB. And orange colored urine. Why is that urine orange colored? They have TB. We expect them to be on what? Rifampin. Remember, rifampin changes the color of the urine to orange, and it changes even the patient's tears to orange. And that's why you teach a patient who's going to be on rifampin, you teach them, if you're wearing contacts, that's going to permanently stain your contacts for the time you're on this medication. You have to wear glasses, because even the patient's sweat will turn orange. All of the patient's bodily secretions can turn orange. We expect that. That's expected. That is your most stable patient. There's nothing acutely happening that we're not expecting with this patient. But all the other patients, there's something acutely happening to them. They're not stable. Does that make sense? All right. Next question. Let's do number 4. Let's do a select all that applies. Which tasks are appropriate to assign to the unlicensed assistive personnel? Select all that apply. Remember, guys, we treat select all that apply as what? True or false. And that's how you're going to answer your question. So, what are we going to delegate to the unlicensed assistive personnel? 1, perform mouth care on the client with pneumonia. True or false? True or false? Come on, guys. True or false? Can we delegate that to the UAP? True. Mouth care, yes. Remember, UAPs, they can help you brush your teeth. They can help you comb your hair. They can help you take baths. ADLs, activity of daily living. Mouth care is an ADL. True. 2, apply oxygen via nasal cannula to the client. Applying oxygen. Can we delegate that to the UAP? True or false? False. Oxygen is considered what? A medication. If that patient requires oxygen, are they stable? No. So the LPN can give the oxygen. The RN can give the oxygen, not the unlicensed assistive personnel. How about number 3? Empty the trash cans in the client's room. And I don't think this was a fair question to ask, but I'm going to explain the rationale to you. Empty trash cans. In the real world, the UAPs do it. But in a perfect world, when you guys are reading your textbook, guys, who empties the trash cans? Environmental services. Remember, in a perfect world, we got everything for everyone, right? So no, you are not going to delegate that to the UAP. The environmental services does that. The UAP's job is what? The patient. So that's false. What about 4? Take the empty blood bag back to the laboratory. True or false? Can the UAP take the empty blood bag back to the laboratory? Oh, you guys are mixed. I'm seeing half true, half false. True. Remember, the UAP can transfer stable patients. They can transfer or transport, I should say, medications. They can transport blood. All they're doing is moving it from one place to another. That doesn't require any nursing judgment. True. You can tell the UAP, hey, please bring this to this floor. Go bring it back to the blood bank. They're not evaluating anything. They're not assessing anything. They're just transporting that blood from one place to another. They absolutely can transport. Danielle, if you don't stop. What about number 5? Show the client how to ambulate on the walker. Can the UAP do this? Show the client how to ambulate on the walker. Very good. No. Because showing the client how to do anything, isn't that a teaching? They can't evaluate, assess, or teach. Very good. Very good. Okay. Let's look at number 5. Number 5. Which client should the medical unit nurse assess for after receiving the shift report? 1, the 84-year-old client diagnosed with pneumonia who's afebrile but getting restless. 2, the 25-year-old client diagnosed with influenza who's febrile and has a headache. 3, 56-year-old client diagnosed with left-sided hemothorax with tidling in the water seal compartment of the pleurovac. Or 4, 38-year-old client diagnosed with sinus infection who has green drainage from the nose. Who are we going to see first? 1, 2, 3, or 4? What do you guys say? Oh, you guys are mixed. I'm seeing lots of 1s and lots of 4s. Let me see what 1 and 4 is. All right, so let's talk about this, guys. And the correct answer is 1. That's who we're going to see first. We have an elderly patient, 84 years old. They have pneumonia. They're afebrile. There's no fever, so that's a good thing. But let's keep going. Look at what it says. Afebrile, but they're getting restless. Remember the list of patients that I gave you that I'm like, these are priority patients. We're going to be going to them first. What does that mean that that patient is getting restless? And that word getting, that means they weren't before and now they're becoming. So that shows us a change in their status. Remember I told you when a patient has a change in their status for the worse? So that's number 1. And number 2, they're getting restless. That's what? Patients having a change in cognition. Remember, that's a patient that we're running to. They're either having lack of oxygen to the brain, they're having a severe infection, they may be having a stroke. We don't know what it is, but we need to find out. Half of you guys chose 1, half of you chose 4. So let me see what 4 was. 4 was a third. If you don't stop, I know half of you guys did not just choose 4. A 38-year-old that has a sinus infection with green drainage from the nose. Green drainage is purulent drainage. It lets us know the patient has an infection, but we know they have an infection. It says that they have a sinus infection. What you think the drainage is going to be clear when they have a sinus infection? Why are we choosing this patient that has an expected outcome over the patient that has an unexpected outcome? Patient has a sinus infection. We expect to see purulent drainage from the nose. It's a sinus infection. That is an expected outcome. But go back to number 1. The patient who has pneumonia, they're becoming restless, is a change in the cognition, a change in what's the word I'm looking for? A change in the level of consciousness. Is that expected for pneumonia? No, it's not. It absolutely is not. So how are we going to choose green drainage from the nose that we expect to see in the patient with sinus infection over the patient that has a change in the level of consciousness? How, Sway? I need you to explain this to me. Don't play. Let's see what the other choices were. 2, the patient, a 25-year-old, they have influenza, they're febrile, okay, and they have a headache. Yes, that patient does need to be assessed, but not first because they have influenza. What are the signs and symptoms of influenza, guys? Fever, headache, body ache, chills. That is an expected outcome of the diagnosis. There's nothing in that tells us that they take priority over the patient who suddenly has a change in the level of consciousness. And choice 3. The 56-year-old, they have a left-sided hemothorax. For all of you guys who chose 3, make sure you go back and you review your chest tubes because it says tidling in the water seal compartment. We want to see tidling in the water seal compartment. That's what we want to see. So why are we going to see them first? We have to see the patient who's most likely at risk to die. All right, moving on. Oh my gosh, this time's going so fast on me. Okay. Let me look for a good one. Let's go to number 7. Catherine. Can you make a video in the future about chest tubes? Okay. I'll add that to my list. I think I already have a video about chest tubes in my respiratory playlist, but I'll make another one for you. Chest tubes. Okay. Anyway, let's do number 7. The client whose 1-day post-op following chest surgery is having difficulty breathing, has bilateral rales, and is confused and restless. What intervention should the nurse implement first? 1, assess the client's pulse oximetry reading. 2, notify the rapid response team. 3, place the client in Trendelenburg position. Or 4, check the client's surgical dressing. What do you guys think? Okay, you guys see it's pretty split. Most of you guys chose 2, which is the correct answer, notify the rapid response team. But the other half of you guys chose 1. I almost said something bad. What the HE double hockey sticks are you thinking when you chose 1? Assess the client's pulse ox reading. A patient's oxygen saturation rate, that tells us how much oxygen is being carried in the blood, how much that patient's being perfused, how much oxygen that patient has, right? Follow me. So when you say, I'm going to check that patient's O2 sat, that means I'm trying to get that information of how much oxygen that patient's getting. So the fact that they have difficulty breathing, the fact that they have bilateral rales, the fact that they have confusion and restless. And I just told you when that patient has confusion and restless, one of the things that happens is they're not getting enough oxygen to their cabeza. That wasn't enough for you? That wasn't enough to let you know this patient's not having enough oxygen? I got to waste time and put a pulse ox on their finger to tell us what? That we don't already know. Remember, and that's how you guys are supposed to think. When you choose an answer, that answer that you're choosing better tell you something that you don't already know. The fact, guys, that they told us the patient's having difficulty breathing, they have rales, they're confused and restless, that lets us know that we assess them. We have enough information to know that this patient is having trouble breathing. They're in trouble. Why are you going to waste time doing an O2 SAT? That's not going to tell you anything that you don't already know. It's time to act. You better call that rapid response. I'm trying not to get... All right. Anyway, let's look at our other choices. 3. I know some of you guys did not choose 3. I know some of you didn't choose 3. Are you serious? Tell me, putting that patient in Trendelenburg position, what's that going to do for your patient? What's that going to do? Because last time I checked, I don't see that patient going through hypovolemic shock. I don't understand. I don't understand. Why are we putting them in Trendelenburg position? What is that going to do for the breathing? Where in the west side of Wakanda are we going to choose put the patient in Trendelenburg's position? Help me understand. Well, it's 4. I didn't see anyone choose 4 much, which is check the client's surgical dressing. We check a patient's surgical dressing if we suspect, patient's bleeding out, right? Okay. Let me get a second, calm down. I'm over here getting mad at you guys. Oh, okay, this is a good one. Let's do number 11. Number 11. You guys ready? All right. The charge nurse on the critical care respiratory unit is evaluating arterial blood gas values of several clients. Which client would require immediate intervention by the charge nurse? And so I hope you guys have your book with you because there's a lot of numbers here, guys. So, which client would require immediate intervention by the charge nurse? Who are we running to first? Who's priority? Who's worse off? Who's most likely to die the fastest? Here are our choices. One, the client with COPD, they have a pH of 7.34, PaO2 of 70, PaCO2 55, bicarbs 24. Choice number two. The client with adult respiratory distress syndrome, pH 7.35, PaO2 75, PaCO2 50, bicarb 26. Choice three, client with reactive airway disease, pH 7.48, PO2 80, PaCO2 30, bicarb 23. And last, we have the patient with a pneumothorax. Their pH is 7.41, PaO2 98, PaCO2 43, and the bicarb is 25. What do you guys think? Very good. Most of you guys got the answer. And it's at number three, that patient that has reactive airway disease, the pH is 7.48, PO2 is 80, PaCO2 is 30, and the bicarb is 23. What is this patient experiencing? Respiratory alkalosis. I actually did 2 videos. They're not going to come out till I think December on acid-base balance, but I have other videos already in my respiratory playlist on acid-base balance. Make sure you guys watch it if you're having a problem with acid-base balance. But your key when it comes to acid-base balance, the first thing you guys are always going to look at before you look at anything else is going to be the pH, because that pH is going to tell you if the patient's in acidosis or alkalosis. Remember, the pH is 7.35 to 7.45. That's your range, 7.35 to 7.45. Anything less than 7.35, that patient's in acidosis. Anything more than 7.45, that patient's in alkalosis, right? So the pH tells you if they're in acidosis or alkalosis. And then from there, you have to find out if it's respiratory or if it's metabolic, right? If it's respiratory, that CO2 is going to be out of range. If it's metabolic, that bicarb is going to be out of range. So the correct answer, guys, for this patient is number three. This patient's going through respiratory alkalosis. Now let's talk about these other choices so you can understand why that's not it. Let's look at number one. The patient has COPD. Look at those labs. These labs tell us respiratory acidosis. I expect the patient to be in respiratory acidosis with COPD. Hello? COPD. The patient's holding on to all their carbon dioxide, or I like to call it carbon diacid, to remind me that carbon dioxide is acidic. They're not breathing off that CO2 the way they're supposed to. So normal CO2 35 to 45, but because they're holding it in, I expect that CO2 to be higher than 45. I expect them to be in respiratory acidosis. They have COPD. That is an expected outcome. Remember, guys, you're going to run to that patient that has an unexpected outcome. You're going to run to that patient that is most likely to die. Patient with COPD, they're going to have respiratory acidosis because of the disease process. Next. Choice two, the patient respiratory distress syndrome. Look at the pH, 7.35. Now, it's on the lowest end of the normal, but it's still in the normal. pH, 7.35, 7.45. The pH, that's your end game, guys. The pH is what lets you know if the patient's fully compensated or not. Because everything that the lungs are doing, everything the kidneys are doing is to get the pH to 7.35 to 7.45. All of that CO2 shooting out CO2 or holding on to the CO2, all of the kidneys, the bicarb shooting out HCO3 or holding on to it, all of that is to get the pH between 7.35 and 7.45. And choice number 2, the pH is 7.35. So why are we running to them? Next one. Choice number 4. Look at that pH, 7.41. Again, we want the pH to be between 7.35 and 7.45. This is 7.41. So why are we running to them? It's within normal limits. Number 1 is not within normal limits, but we expect to see that in a COPD patient. But choice number 3, reactive airway disease, 7.48. No, that's who we're running to. It's not expected, and it's outside the normal limits. Thank you, Kearns. Oh, March Girl 07. We're on page 78, or we're about to be on the next page. We're on page 80. Page 80. Okay, C. Williams. Let's do on page 80. Let's do number 20. Everyone there? Page 80, we're going to do number 20. Yes, Catherine, pH is your key. Yes, that is the name of the game. Absolutely. All right, number 20. The charge nurse in the ICU asks a nurse to float from the medical surgical unit to the ICU. Which client should the charge nurse assign to the float nurse? 1, the client who's 3 hours post-op lung transplant. 2, the client who has central venous pressure of 13. 3, the client diagnosed with bacterial pneumonia. Or 4, the client diagnosed with hantavirus pulmonary syndrome. What do you guys say? What's your answer? Very good. Number 3. Number 3. Because number 3, guys, that's the most stable patient, right? The patient with bacterial pneumonia. That's number 1. And number 2, go back to the question. I want you guys to catch this. It says that you're the charge nurse in the ICU, and they ask a nurse to float from the medical surgical to the ICU. Guess what? Don't you see bacterial pneumonia on the medical surgical unit? Yes. So not only is this the most stable patient out of all the patients we have, number 2, that patient's background actually fits the background of the nurse that's floating to the floor. Very good. You guys are starting to get this. You guys are starting to get this. Let's do number 25. I'm still on page 80. Let's go down to number 25. Everyone there? All right. Here's what it says. The client diagnosed with active tuberculosis tells the public health nurse, I am not going to take any more medications. I'm tired of them. Which statement is the nurse's best response? 1, you are tired of taking your tuberculosis medications. 2, you must take your TB medications. It's not an option. 3, you must discuss this with your healthcare provider. 4, as long as you wear a mask, you do not have to take the meds. I love this question. Keep going. Keep giving me your answers. All right, let's talk about this because most of you guys chose 1 and 1 is wrong. Now, don't get me wrong. Number one is a therapeutic answer choice, and we love therapeutic answer choice, but number one doesn't answer our question. Look at what the question says. Which statement is the nurse's best response? And in this situation, where tuberculosis is a public health danger, that therapeutic response of number one is not the most appropriate. Number two, you don't have a choice. Let me tell you guys something. You see, when it comes to tuberculosis, if a patient is even suspected of not being compliant, you want to know what the state does? They pay a nurse to go to that patient's home every day and give them that medication and watch them swallow it. Yeah, because tuberculosis is a public health concern. Mhm. So you don't have a choice in this matter. You're going to take it voluntarily or involuntarily, but you're going to take it. Yeah. The nurse will come to their home and give them that medication. They're going to be on that medication for 9 to 12 months, depending on the cocktail that they have. But yeah, the state pays a nurse to go out there every single day, give them the medication, open out, they look all on the tongue, make sure that patient didn't pocket it in their cheeks, make sure that patient swallowed it. But you're going to take this medication. You do not have a choice. Now, we can talk about your feelings later if you want, but let's get this clear. You're going to take this medication. You don't have a choice in this matter. Make sure you guys brushing up on your tuberculosis. Tuberculosis is important. You guys got to know that. Freeman said, "Oh my goodness, yeah, it's true. I thought the patient can refuse, not TB meds, because this is a public concern." Let's go to page 81. I'm trying to think of the name of what it's called when the nurse goes out and has to give it to him every day, and there's a phrase for it, but what's it called? I can't remember the name of it, but there's a phrase for it of what it's called. But absolutely, they can't deny it. They have to take it. All right. Let's do number 27. Number 27 on page 81. You guys there? All right. Thank you, Mayop. DOT, direct observation therapy. Thank you. I couldn't remember the name of it. Thank you. That's what it's called, direct observation therapy. Will the police be with the nurse? Sometimes if you have a patient that is aggressive and the nurse gets there and they don't feel safe, they will have a police officer come out. Nishama, I promise I'm not lying to you. This is true. I promise. I have no reason to lie to you guys. This is true. Go open up your textbook. You'll see it. I'm not making this up. I promise you. Okay. Let's look at number 27. It says, the unlicensed assistive personnel tells the clinic nurse that the male client in room 1 is really breathing hard and can't seem to catch his breath. Which instruction should the nurse give the UAP? 1, put 4 milliliters of oxygen on the client. 2, sit the client upright in a chair. 3, go with the nurse to the client's room. Or 4, take the client's vital signs. What do you guys say? 3. What do you guys say? 3. I gave you the answer. The correct answer is 3. Let's talk about this. Let me tell you something. If you get a test question, you don't know the disease, you don't know the medication, you don't know the answer. Let me say this to you. Whenever somebody comes to you, whether it's an LPN, it's a UAP, it's a respiratory therapy, I don't care. Somebody comes to you and tells you that something's going on with your patient. The correct answer is always going to be you go back to that patient to assess them, or you going back to that patient. When somebody comes to tell you something's wrong with your patient, you never send them back to the patient. Your answer is always going to be you going to that patient. Now, if nothing's wrong with the patient, they're giving you a report. That's something else. But if they come to tell you something's wrong with the patient, you have to go see that patient. You never pass the buck. You have to check them yourself. All right, number 29. The client calls a clinic nurse and asks, what is the best way to prevent getting influenza? Which statement is the nurse's best response? One, take prophylactic antibiotics for 10 days after being exposed to the flu. Two, stay away from large crowds and wear a scarf over your mouth during cold weather. Three, the best way to prevent getting influenza to get the yearly flu vaccine. Or four, you must eat 3 well balanced meals a day and exercise daily to prevent influenza. Very good. Everyone got this correct. 3. So another thing with NCLEX, they are very big on preventative measures, and you guys do need to know the difference in those preventative measures. So a question like this is primary prevention. Primary prevention, vaccinations, education. That's primary. Secondary prevention would be things such as mammogram or colonoscopy with secondary preventions or a biopsy, right? Where we're testing to see if a patient has something and if they do have it to see what the extent of it is versus primary where we're trying to prevent them from getting it at all, right? And then you have tertiary prevention. Tertiary prevention, unfortunately, they already have it, but we want to prevent it from getting worse. So tertiary prevention will be something like occupational therapy, speech therapy, physical therapy, right? They already have that deficiency and we want to keep it worse. Primary, vaccines, education. Secondary, um, diagnostic tests such as, like I said, the mammogram, biopsy, colonoscopy. And tertiary, we want to keep it from getting worse. Things like speech therapy, occupational therapy, physical therapy. You need to know those, okay? Number, ooh, guys, I have so much to go over with you, but this is going to be my last question. I have to go get ready. My birthday celebrate starting early. Hold on a second, second, guys. It's a surprise. I don't even know where they're bringing me. Okay. One second, guys. Give me 1 second. Thank you. Thank you so much, guys. Big Leo energy. Thank you. All right. So, number 31, the nurse accidentally stuck with a needle used to administer an intradermal injection for PPD. What intervention should the nurse implement first? 1, complete accident or occurrence report. 2, immediately wash the area with soap and water. 3, ask the client whether he or she has AIDS or hepatitis. That's not the answer, guys. Or 4, place an antibiotic ointment and bandage on the site. That one was too easy. I'm going to do one more with you. The correct answer is 2. It's always going to be 2. The first thing you're going to do always is to wash off that area, guys. Okay, let's do number 34. This is a good one. I'll end on number 34. You guys there? Page 82. The nurse encounters a client who does not respond to verbal stimuli and initiates CPR. What should the nurse do? Prioritize the nurse's actions from first to last. So the patient's unresponsive. You say, Mr. Such and Such, are you okay? Are you okay? Now, if they look up to you and they say, no, I'm not okay, are you going to do CPR? No, because they're breathing, right? The heart's beating. They were able to open their eyes and tell you they're not okay. But in this question, they tell you that the patient is unresponsive. You start CPR. What do? Here are the choices. Open the client's airway, check the client's carotid pulse, assess clients for unresponsiveness, perform compressions, pinch the nose, and give 2 breaths. So the first thing we're going to do is assess for unresponsiveness. Because remember, we have to check. Thank you guys so much. We have to check. We have to do all of these steps. So the first thing we're going to do, check for responsiveness. Make sure they're not responding. Are you okay? Check for unresponsiveness. Next, then we're going to do our compressions. 3, notice how the compressions go before airway, because remember, it used to be airway first, then compressions. Now we start with the compressions first. So we're going to make sure that they're not responsive. Start with compressions, then do the airway. Then after that, we're going to pinch the nose to give 2 breaths. And then last, we're going to check the carotid pulse. And if they don't have a pulse, we start all over again. And I want you to think about it, guys. Why did we check the airway first, open up the airway? Because how are we going to give them breath if the airway is not open, if it's not clear? It has to make sense. So that is the order that you guys are going to do things. Professor D, can we cash app you for your birthday? Yes, you can. Oh, I love that question. Oh, thank you. Thank you so much, Hillary. Thank you. Absolutely, guys. If you guys appreciate this and what I brought to you, gifts of appreciation are absolutely welcome. I got Cash App, PayPal, and Venmo. So gifts of appreciation are welcome. There's so much more that I want to cover with you, and I'm going to keep this going. Just remember, guys, soccer season has started. And I'm so proud of my son. He's got scouted for Inter Miami Academy. So he is on that team. And so with the soccer season starting, that really dictates my schedule. So I'm not sure when the next live is going to be, but it will be within the next 30 days. I'm going to try to give you guys, thank you, Julia. I'm going to try to give you guys a live at least once a month, but it really goes according to that schedule. But the people who are going to benefit the most from this, if you're currently in school, by the time I'm done with you, if you guys stay consistent and you guys keep rocking with me and you guys keep supporting me, by the time I am done with you, you're going to walk in there, take your NCLEX, bam, 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 walk out and pass. Okay. So just give me some time and give me some support, because I cannot do this without your support. Thank you, Love Bryant. Thank you, SL. Thank you so much. Thank you for your support. Martha, thank you. You guys are so sweet. I turn 25 tomorrow. 25. Roy Rye. Okay. Cash App handle. I don't know. What's my Cash App handle? I'll tell you in a second. I think it's in the description. I don't know how to find my handle. Oh, it's my name. So it's my name. It's my name, Eva Deliverance. That's my Cash App handle. C. Williams, thank you. Thank you so much, guys, for your support. Let me know in the comment section, because I'm going to go back through this, not today and not tomorrow, because tomorrow's my birthday. I'm taking a break. But I'm going to go through the comment section, and everything that you guys see that you want me to do either live or video on, I'm going to do that for you. Just give me enough time. And something else I wanted to know. On the next live, do you want me to continue with respiratory, or I've given you enough, you can figure out the rest? And do you want me to move to just another subject? That's something else I wanted to ask you guys. I'll leave that up to you depending on the vote. Can you do a podcast? Samaya, I was doing a podcast, but I just have so much going on. I had to stop the podcast because the podcast was taking away from me doing these videos for you. And at the end of the day, I think a lot of my facial expressions kind of help you remember certain things. So I had to make that decision on where I was going to donate that time to, because at the end of the day, guys, remember, I still got to work. I still got to pay these bills. But I'm asking you to support my channel, because the more you support my channel, the more that I'm able to dedicate more time to you guys. And this is where my heart is, teaching you guys this information, making sure that you do it right the first time. Okay, go ahead. Just put in the comment section. I promise I'm going to read every single one. Thank you so much, guys. Thank you for supporting me. Thank you for all of the birthday. Wow, all of the birthday Cash App, Venmo, PayPal. Oh, you guys are hooking me up for my birthday. Thank you so much. All of your gifts of appreciation are loved. They're appreciated. They're welcome. Thank you so much, guys. And you guys will be catching me on the next video. Thank you.